If you or your loved one go to hospital following a stroke, you would expect that nurses looking after you would be up to date and give you care that we know has been proven by prior research. But unfortunately, that is not the case with our stroke patients. For the past 10 years, we have known that if a stroke patient develops a high fever, a high blood sugar level, or who has difficulty swallowing in the first 3 days following their stroke, then the core of the stroke will extend into the penumbra, or it will get larger, and the stroke patient will have a more severe disability and possibly even die. I examined the medical records of over 700 patients and found that over 75% of stroke patients did not receive Panadol to treat a fever. Over 50% of patients did not receive insulin to treat high sugar levels, and over 60% of patients did not receive a simple swallow test when they were first admitted to the hospital. So next, using a randomised controlled trial, I investigated a program to change nurses' behaviour and improve the management of fever, sugar and following for stroke patients. It was anticipated that this program would also decrease death and disability for our stroke patients. 19 hospitals were involved in my study, and they were divided into two groups. The first group, which involved 10 hospitals, received 3 simple protocols to manage fever, sugar and swallow, and an education program. The second group, which involved 9 hospitals, did not receive the protocols or the education program. To see if this program worked, I then audited the medical records of another 1,000 patients, and I found that patients who were admitted to the hospitals who had received the protocols, that the patients were less likely to develop a fever, they were less likely to develop high sugar levels, they were more likely to receive a swallow test, and importantly were discharged 2 days earlier than stroke patients who were admitted to hospitals who did receive the protocols. But importantly, patients who were admitted to the hospitals who received the protocols were 16% more likely to be alive and independent at 3 months following their stroke, which is a greater effect than any current drug or medical intervention that we've used for stroke. So what does this suggest? This suggests that changing nurses' behaviour can be just as important as any medical breakthrough, and we must continue to investigate simple approaches to help nurses get up to date with what we know works. Thank you.